Hello guys, welcome to Dr. Science. So today we are going to talk about renal stones. And in this topic I'll be mainly talk about the types of stones such as your calcium oxalate stones, your phosphate stones, cystine stones, and finally your uric acid stones. First we will talk about the calcium oxalate stones. Calcium oxalate stones are the most common type of stones that you will see in your patients. Most common type of renal stones that you will see in your patients. Now, why these stones are forming? Normally in our body, calcium and oxalate are inhibited by a substance called as your citrate. Okay. Usually citrate is a inhibitor which is inhibiting calcium and oxalate nucleation. Now imagine there is decrease in citrate or there is decrease in the inhibitor such as your citrate, the calcium and oxalate will nucleate, or calcium and oxalate will fuse together and they will form calcium oxalate stones. Now these calcium oxalate stones are usually radio opaque. Now what is meant by radio opaque? Suppose this is the kidney. And we did an X-ray. Whenever we do an X-ray, if the substance is white in color, since I don't have a white marker, I will be drawing with the pink marker here. If any substance is looking white on X-ray, that substance is called as your radio opaque substance. Now this calcium oxalate stone is a radio opaque substance. It means it will appear white in color in an X-ray. Now the most important thing here to note is that calcium oxalate stones and your phosphate stones, they are radio opaque, and not only that, they are usually formed when there is increased alkali in our body. Okay, so we can simply call them as your alkaline stones. Okay, on the other hand, we have the cystine and uric acid stones, and these stones are usually radiolucent. Now what is meant by radiolucent? Suppose this is the kidney and you did an X-ray of the kidney, and on X-ray you see a very black substance. Such substances are called as your radiolucent substance. Okay, so on X-ray these stones appear black in color, hence they are called as your radiolucent stones. Once again, calcium oxalate and phosphate are alkali stones and they are radio opaque, means they appear white in color. On the other hand, cystine and uric acid stones are radiolucent. It means they appear black in color. And finally, these stones are acidic in nature. Compared to the calcium oxalate and phosphate, they are alkali in nature, and these stones are acidic in nature. Cystine and uric acid stones are acidic in nature. Now if you are clear with the calcium oxalate stones, we will talk about the phosphate stones. One more thing about the calcium oxalate stones is that Sorry for the interruption. Okay, so one more thing about the calcium oxalate stones is that they are spicule and they can present with hematuria. Now what is meant by this? Now imagine this is the calcium oxalate stone. Usually this calcium oxalate stone will have a lot of spicules present on it, spikes present on it. Now whenever there are spikes present on it, and this stone will pass through the ureter, obviously the epithelium will get ruptured and the patient can present with hematuria. I hope you are clear with this. So calcium oxalate stone, they can present with hematuria because they have spicules or the stones are spiculated, and whenever the stone is passing through the ureter, it will rupture the epithelium, hence the hematuria is present in calcium oxalate stones. Next we will talk about phosphate stones. Now these phosphate stones are radio opaque. It means they will appear white and they are alkali stones. Okay, this is very important. Now phosphate stone compared to the calcium oxalate stones, they are smooth surfaced. They are smooth surfaced. Hence there will be no hematuria most of the times. Now why the question arises is that why phosphate stones are forming. Now in order to understand that, you have to understand urease positive organisms such as your Proteus mirabilis, Klebsiella pneumoniae, and finally Proteus mirabilis, Klebsiella pneumoniae, and your staph. All these organisms, not only that, we have pseudomonas also, pseudomonas. All these organisms are urease positive. Now what is the function of this urease enzyme? Normally in our body, urea is converted into ammonia by an enzyme called as your urease. Now this ammonia, it is an alkali, and whenever there is increased alkali in our body, there will be formation of alkali stones such as your phosphate stones. Okay, so once again, in our body, whenever there is increased urease positive organisms such as your Proteus mirabilis, Klebsiella, pseudomonas or staph, they will produce the urease enzyme and they will convert the urea into ammonia, and the ammonia is an alkali, hence the alkali stones such as your phosphate stones are formed. Now the important thing here is that usually suppose this is the phosphate stone. Suppose this is the phosphate stone. Phosphate stones have a lot of bacteria present on it, or we can simply say that bacteria loves phosphate. Hence, whenever you have a phosphate stone, there is increased chance of infection. Okay, please remember this one. Now these phosphate stones are usually divided into two types. One is your simple phosphate stone, the other one is your complex phosphate stone. First we will talk about the simple phosphate stones. Simple phosphate stones are usually comprised of two things. One is your magnesium, the other one is your phosphate. In simple stones itself, we have the other stone which consists of calcium and phosphate, and finally we have one more stone which consists of ammonia and phosphate. So once again, we have two types of stones in phosphate stones. One is your simple phosphate stone and the complex phosphate stones. So in simple phosphate stones, we can see magnesium phosphate stones, calcium phosphate stones, and ammonium phosphate stones. Okay, if you are clear with this, next we will move to the complex type of phosphate stones. This complex type of phosphate stone is usually divided into three. One is your struvite, or first we will start with the most important one, which is your triple phosphate stones. The second one is your struvite, stone, and the third one is your bruchite stone. I will not talk about bruchite stone since it is not so important, but triple phosphate stones and struvite stones are very important, and the composition of struvite and bruchite is the same, and they are kind of similar to each other. So let's talk about the triple phosphate stones. As the name suggests, whenever we are talking about triple, means it consists of three elements and one phosphate. Okay, now what are the three elements of the stone? We will try to understand by drawing a small diagram here. So this is the stone. The first element is your calcium. The second one is your magnesium. The third one is your ammonia. And finally we have your phosphate. Let me charge my tablet really quick. So I already said you that triple phosphate stones contains of three elements. One is your calcium, magnesium, ammonia, and finally one element is your phosphate. So triple phosphate stones consist of three elements, that is your calcium, magnesium, and finally ammonia. Okay, now second most important one is your struvite stone. Now struvite stone is also a type of complex phosphate stone. Now what is the composition of a struvite stone? We will try to understand by drawing a small diagram here. So this is the struvite stone, and it is also having similar composition of a triple phosphate stone. So the first thing is your calcium, the second one is magnesium, the third one is your ammonia, and finally one of the element is your phosphate. But the only thing that differs here is that it is made up of calcium hydroxy apatite. Okay, Now, aside from that, the most important thing here is that in Stewart stone, you will see the staghorn calculus. It means what is meant by this staghorn calculus. Please write the definition of it. Staghorn calculus. It is when a complex phosphate stone occupies greater than 2 renal pelvic renal wait a second greater than 2 renal pelvic calcial system. Okay, so a staghorn calculus is a complex phosphate stone which occupies greater than 2 renal pelvic calcial systems. So once again, this is the kidney, and we have the renal calyces here, 1 2 3 and 4. Okay, so here is a phosphate stone, and this phosphate stone is very big, and this phosphate stone is occupying nearly greater than 2 or equal to 2 renal pelvic calcial systems of the kidney. Such type of phosphate stone, or such type of complex phosphate stone which occupies greater than 2 renal pelvic calcial systems of the kidney are called as your staghorn calculus. I hope you are clear with the definition. Now finally we will talk about the cystine stones. Cystine stones are radiolucent. It means they will appear black in color on when you take X-ray, and not only that, they are acidic stones. Okay, normally you will find these cystine stones when you have cola metabolic defect. Okay, cola, C stands for cystine, O stands for ornithine, L stands for lysine, A stands for arginine. So cystine stones are usually seen in cola metabolic diseases. Okay, and finally we are going to talk about the uric acid stones. Uric acid stones are also radiolucent. It means they will appear black when you take X-ray, and on the top of that they are acidic stones. Now where do you see these type of stones? Whenever you have gout or pseudo gout, there is increased in uric acid in our body, hence you will see uric acid stones in the kidney. And aside from, you can see this in tumor lysis syndrome, because in tumor lysis syndrome the cells which contain the DNA, and DNA consists of uric acid. Okay, when DNA is broken down, it will form uric acid, and this uric acid will get excreted in the kidneys, hence you can see the uric acid stones in your kidney. Finally, I forgot to tell one of the important thing here. Usually the calcium oxalate stones, the calcium oxalate stones are divided into two types. One is your calcium monohydrate, and the other one is your calcium dihydrate. Calcium monohydrate stones are usually dumbbell shaped. On the other hand, calcium dihydrate stones are enveloped shaped. Okay, and the most important thing about calcium monohydrate stones is that they are resistant to extra shock wave lithotripsy. Now, what is meant by this? It means we are going to generate shock waves through a machine, and these shock waves will break the stone. Okay, that is meant by extracorporeal shock wave lithotripsy. And calcium monohydrate stones are usually resistant to it. On the other hand, calcium dihydrate stones are not resistant to extra shock wave lithotripsy. So that was about renal stones, guys. Thank you.